Okay, so good evening, everyone. Thank you for joining me live today. So we're going to be talking about blood pressure medications today, anti-hypertensive medications, okay? And before we move on, this is going to take no less than, sorry, it won't take more than 40 minutes. So this session, I would not be recommending any medications. Okay, this is solely for educational, informational purposes. All right, so if you need medications, you would have to go to your doctor for that. Okay, so for someone to be placed on blood pressure medications, their blood readings should be above 140 millimeter per mercury. Okay, if you have not had such a high reading before, you don't need to be on medications. All right. What you should work on is your lifestyle modifications, your lifestyle choices. All right. You should not have been placed on medications. I know in Nigeria, if someone just has a high BP of 130, it's like almost the first thing to do is to recommend a medication for them, right? However, that's wrong because people who don't have readings that are above 140 are not considered to be hypertensive. They are still in the pre-hypertensive stage. Okay. So if you are on antihypertensive medications, but your reading hasn't, gone above 140, I'm not saying that you should stop your medications. Okay, you're just not supposed to be on them. Simple lifestyle modifications could help you, okay, to bring down your blood pressure. All right, so we know that antihypertensive meds, they help to keep our blood pressure at healthy levels. All right, and they are usually the first recommended to a hypertensive patient. Sadly, most people don't talk about, what should I say, most physicians don't really dive into lifestyle care, they just recommend a medication for you. Some people who are hypertensive don't even go to their physicians to have like monthly checkups before they are then placed on drugs. Okay. So it's just something that our healthcare system needs to improve on, because once people start these medications, it's quite difficult to get off of them. Okay. Now, for some hypertensive patients, you can be on BP meds you can be on as many as 1 to 6 different blood pressure medications at once. Okay. Now that's totally normal. Even though most people wouldn't recommend up to 6 for you, but some people have up to 6 different medications that they take. Okay, just to help them manage their blood pressure. All right. And it's also important to note that BP meds do not treat hypertension. They are just for management purposes. Okay. They don't make your hypertension go away. You are meant to take them almost day in, day out to make sure that you manage your hypertension. All right. So these are just some of the little things we need to know about BP meds. Okay. So let's talk about some types of BP meds and how they work. So we have diuretics, we have beta blockers, we have alpha blockers, ACE inhibitors, angiotensin II receptor blockers, we have calcium channel blockers, we have vasodilators. There are many more, but these are the most common. Okay, and this is what we're going to be talking about today. So we are going to look through this list and see where your own BP medications fall into, so that you can know what you are taking and what is doing to your body. Okay. So let's start with diuretics. So these basically, they help to get rid of excess fluid and sodium in our body. Okay. So the less sodium you have, because salt sort of attracts water. Okay. The less sodium, the less fluid. Okay. And the less fluid, the lower your blood volume. Okay. And the lower your blood volume, the lower the pressure that your blood will be exerting on your blood vessel. okay? So take, for instance, a tire that has less air will have less pressure, okay? So the lower the volume, the lower the pressure. So this is what diuretics simply help you to achieve. Now, I'm not going to lie, I cannot pronounce most of these names, but some examples of diuretics are furosemide, bumetanide, etc. Okay, so if you can look through this list, if you see anyone that's you are probably taking at the moment, furosemide and hydrochlorothiazide are the most popular diuretics in Nigeria. Okay, so just take a few seconds to look through this list to see if any of these hypertensive medications is what you are taking at the moment. And you can know that that is a diuretic, okay? So the next thing we have is beta blockers. Now these work, they cause your heart to beat slower and with less force, okay? Now it helps you achieve this by blocking an enzyme that we call epinephrine. Now, epinephrine basically is the hormone that is responsible for fight or flight, okay? Now, if you are in a room, or let's say you are in the parlor or in the sitting room with your kids and your wife, and all of a sudden a lion appears out of nowhere, okay? Your first reaction is you have to run away, right? That's a scary thing to see. Okay, so this hormone that causes you to want to either fight or flight, that is to leave that particular environment, is called epinephrine. Okay, now you can imagine if you are in the sitting parlor with your family and you see a lion or a snake or something like that, and you have that sort of shock, should I say, it increases your blood pressure, okay? And it causes your heart to beat faster, okay? Now, beta blocker medications, what they do to you as a hypertensive patient is that they help to slow down your heart rate, okay? Let your heart beat with less force. And they do this by basically hindering that fight or flight hormone that we call epinephrine, okay? So I hope that this is clear. And an example I have here is if you have a car that has been running for 50 years, you can't take that car into a racing ground. Say that you want to race with race cars. Okay, if you've been driving a particular car for the past 50 years, okay, it's the same thing with your heart as well. Your heart has basically been keeping you alive since you came into this world. Okay, now you don't want that heart beating as fast as it can day in, day out, okay? Essentially, slow and steady wins the race. So your beta blocker medications will help to sort of slow down your heart rate, let it beat with less force so that you can live longer, okay? So this is what beta blockers help us to achieve, and I hope that it's clear, okay? So some examples of beta blockers: bisoprolol, carvedilol, esmolol. So we have a few examples here, okay? You can also go through this list to see if any one of your medications fall into this category so that you can know that what you are taking is a beta blocker, okay? All right, so let's move on. The next type of BP medications we have is ACE inhibitors. Now, ACE stands for angiotensin, the C for converting, and the E for enzyme, then inhibitors, okay? So let's start by explaining what angiotensin is. It's an enzyme that tells your blood vessel to constrict, okay? So we can see here in this photo that I attached, when angiotensin is released and converted, it sort of causes your blood pressure to squeeze in, okay, to constrict. Now, less angiotensin would definitely lead to a wider blood pressure, a wider blood vessel, right? So let's say here at this moment, angiotensin hasn't been released yet, okay, as opposed to here when it has, okay? So less angiotensin would lead to a wider blood vessel, which would then lower the blood pressure. So the more space your blood has to flow, the lower the pressure within that blood vessel. Yeah. So your ACE inhibitor medications, what they do is that they inhibit this enzyme that we call angiotensin. Okay. So it doesn't make it active, it deactivates it, sort of. Okay, it inhibits angiotensin. Okay, so that's what we call ACE inhibitors. So some examples we have captopril, lisinopril. I know some of you take this one. So these are just some examples of ACE inhibitors. And actually, these are one of the most recommended BP medications. They are really safe and they are just the most recommended. Okay, so doctors like to give this out a lot because they are really good in managing blood pressure. Okay, so lisinopril and pamipril are some of the most popular ACE inhibitor medications in Nigeria. Okay. Now, the next one we have is angiotensin II receptor blockers. So we just learned about angiotensin, right? We've learned that angiotensin constricts our blood vessel. It makes it narrow, right? Now, when the body activates angiotensin to angiotensin II receptor blockers, they are medications, right? So these medications would block the receptors instead of the enzyme itself. Okay. Now, I know this may seem like big grammar. So let's look at this diagram. Okay. So we can take this black little ball here to be angiotensin, or should I say converted angiotensin. So now it's angiotensin II. Okay. So we can take this to be angiotensin II. Now, we know that angiotensin, what it does is going to make our blood vessel constrict, right? So instead of your medications blocking this angiotensin itself, it can block this receptor here, this thing that looks like a fork sort of, that's, catches the angiotensin, okay, and would make it to constrict your blood vessel. It will block it instead of blocking the enzyme itself, that is this black ball, okay? So that's what angiotensin II receptor blockers, we call these orange fork thingies, we call them receptors, okay? So instead of angiotensin attaching itself to its receptor, it will just, sort of float around your system until it deactivates, okay? So your medications would block these receptors to not, take up those angiotensins, okay? So that your blood vessels do not constrict, all right? So some examples of angiotensin II receptor blockers. We have losartan potassium. I know some of you take this as well. Olmesartan, valsartan, etc. I cannot pronounce all these names, okay? Well, you can just look through this list to see if the one that you are taking is an angiotensin receptor blocker, okay? So that you can know what it does to your body, okay? All right, so the next one we have is calcium channel blockers, okay? Now, your arteries, they have what we call calcium channels. Now, calcium, when it gets through, it makes your arteries to constrict, okay? And remember, your arteries are what carry blood throughout your body, okay? Oxygenated blood throughout your body. So when calcium comes in contact with your arteries, it makes them to constrict, kind of like the same thing that angiotensin does, okay? So blocking these channels prevents calcium from constricting the blood vessel, okay? So this is what your calcium channel blockers help you to do. They block the channel that is going to catch that calcium, okay, that will make your arteries to constrict. It will block those channels, okay, so that calcium wouldn't get through your arteries and cause your arteries to constrict, okay? So that's one way your calcium channel blockers work. And the next way is that your heart contains some nodes, okay? We have the SA node and the AV node. And these nodes basically control the way your heart pump. So your SA node will be somewhere around here, if you follow my pointer, and your AV node will be somewhere around here. Okay, so here we have the left chamber of your heart. So we have your left atrium here, your left ventricle here, your right atrium here, your left ventricle here. Okay, so basically when blood flows through this blue vein, okay, it enters into your right atrium. All right. And now what happens is that this blood is basically deoxygenated. Okay. And it needs to go into this pulmonary artery that will get into your lungs to sort of oxygenate the blood again. Okay. And then basically pass it down to your left atrium and your left ventricle and then into your aorta, all of those, the way, basically the physiology of your heart, okay? But the message I'm trying to pass is that your SA and your AV node, your SA nodes control the constriction and relaxation of your atrium here, okay? And when this valve opens up, it passes it down into your right ventricle here, okay? And when this valve opens up, it passes it into your left ventricle, okay? So your SA nodes would sort of make this upper part to constrict, let blood get into the ventricle. And your AV node would then force that blood out either into your pulmonary artery or into the aorta, depending on the type of blood that is passing. Okay, so these SA nodes and AV nodes can also be controlled by calcium. Okay, now if you have a high level of calcium, it can cause these SA and AV nodes to sort of, should I say, cause your atrium and your ventricles to constrict forcefully, a lot forcefully than they are supposed to. Okay, so your calcium channel blockers would sort of make your heart beat with less force. Okay, so your SA nodes and your AV nodes would sort of reduce how much it causes your atrium and your ventricle to constrict and relax. Okay, so this is basically what your calcium channel blockers do. They block off calcium. And one thing calcium does is that it constricts your arteries, which is number one. And number two, it also controls how much your SA and your AV node constricts to allow blood pump in and out. Okay, so your calcium channel blockers will help to sort of reduce the way your heart pumps blood or reduce the force at which your heart pumps blood in and through the atrium and the ventricles, and also reduce the constriction of your arteries. Okay, so some examples of calcium channel blockers, we have amlodipine, felodipine, nifedipine. Okay, I know some of you take amlodipine a lot. So this is what amlodipine sort of does. Okay, it's a calcium channel blockers. It's a calcium channel blocker, and amlodipine and nifedipine are the most popular here in Nigeria. Okay, so I hope that we understand what calcium channel blockers help us to do. Okay, all right, so the next thing is vasodilators. Now these help to relax your muscles. So we know how we have calcium and angiotensin sort of constricting our blood vessel. Yeah, vasodilators would help the muscles of your blood vessel to relax, let blood pass through. Okay, so some examples of these are minoxidil hydralazine. Okay, these are vasodilators. Okay. Okay, and the other one we have is alpha blockers. So we talked about beta blockers before. Those are the ones that help our heart beat with less force. These are alpha blockers, okay? Now, these lower blood vessels by preventing a hormone that we call norepinephrine. It's kind of the same thing as adrenaline, okay? And this basically tightens the muscles in the walls of your smaller arteries and veins, okay? Now, if you look at this blood vessel here, you can see that it sort of branches into tinier and tinier and tinier blood vessels, right? Now, your alpha blockers would help prevent those tiny or smaller arteries and veins from tightening, okay? Because when those ones tighten, it increases the blood pressure, okay? So as a result, the blood vessel will remain open and relaxed. It would improve blood flow and your blood pressure would decrease, okay? And this can also help to improve urine flow for men who have prostate problems, okay? Alpha blockers. So some examples of this, we have prazosin, terazosin, doxazosin. I don't know if any of you take any of these medications here, alpha blockers, okay? So there are so many more examples or types of BP medications, but these are just the most common ones, okay? We have diuretics, beta blockers. Remember, diuretics, they help to reduce blood flow and blood volume and sodium. Beta blockers to help reduce our heart rate. Alpha blockers for those tiny arteries and veins. ACE inhibitors, they help our heart beat slower and also reduce calcium. Angiotensin II, vasodilators help to relax your muscles in the blood vessel. Okay, so there are many more categories, but these are just the ones that are most common. Okay, so we have gone through that list of types of BP medications. Okay, so let's talk about some common side effects of BP meds. Now, if you are taking blood pressure medications, everybody reacts differently. So if you don't experience any side effects, great. If you do, then you would have to boost your immune system to help you minimize those effects, okay? And some of those effects can be frequent urination, you feel tired, dizziness, uncontrollable cough. You won't be able to exercise as much as you may want to exercise. Okay, I don't know if you remember from the very first time we met in our webinar, I told you that it's only when somebody eats right and has enough energy that they begin to think of exercising. Okay, so your BP meds can reduce your exercise, level, okay, or how much you exercise. You also have sexual dysfunction, depression. Sometimes you can also have blurry vision as well, okay? So some people, your side effects are different than others, okay? Now, what are some side effects of blood pressure itself? If someone is hypertensive, what are some of the side effects of hypertension itself? None, okay? So I know it's almost like, okay, I'm hypertensive, but I don't have any side effects. Then I am given a blood pressure medication and then I begin to have side effects. It's just the way it is, if I should say. Okay, because someone with a blood pressure reading of 180, 200, 160 can be living their life without even knowing that they are hypertensive or that they need to reduce their blood pressure. Okay, someone can step out in the morning with a healthy blood pressure and come back in the evening with a very high reading. Okay, so hypertension is sort of a silent killer. You don't experience any side effects with it. Okay, but when you get on the medications, you would experience some side effects. Okay, now when you see this sort of should I say, comparison where high blood pressure in itself, no side effects, medications then come with side effects, you will want to stop taking your BP medications. Yeah. So let's talk about what happens if you actually stop your medications abruptly. Okay. Now, the first thing is that your hypertension may come back. Okay. Now, let's say you have done your absolute best, or you've been taking medications, 120, 118, 115. You are so happy, okay, that your BP is down, which is a good thing. So you stop taking your medications just like that. Your hypertension may come back, okay? And the next thing is, if you were on ACE inhibitors, or if you were on beta blockers that sort of suppressed how fast your heart beats, and then you stop taking these medications, your heart may beat dangerously fast, and that would lead to a heart attack. Okay, so please don't just stop taking your BP medications. I know it's hard. You may not want to deal with all these side effects. I can't even imagine taking a pill, every single day. Some of you have been on meds for 10 years, 20 years. You are all remarkable people, okay? But please don't just stop taking your medications just like that, okay? Now, some people can stop taking their meds and they would feel absolutely fine. But with the way hypertension is, somebody can feel absolutely fine and die, okay? So people react differently, even to the side effects of your medications. People react differently. Some people, they are on BP meds, they don't feel anything. They don't experience any side effects, okay? But some people, you deal with dizziness, sexual dysfunction. It's just like you are experiencing everything and anything, okay? So what can you do? If you wish to discontinue your drugs, you have to go and speak to your physician first about it, okay? And you also have to make sure that whatever you are doing can support your blood pressure when you stop taking your BP meds, okay? So for something now like the wellness pack, okay, you have to make sure that whatever lifestyle modification or supplements that you are using to help control your blood pressure is there to help you, okay? Don't just rely on your nutrition, because you don't always get our nutrition right, okay? So if you wish to discontinue your drugs, first speak to your physician about it, and then they would lower your BP medications first so that your body can adapt to you having a lower dosage, okay? So you don't just stop just like that. You have to reduce your dosage first before you get off your drugs completely. And when you are off your medications, you have to make sure that you keep your blood pressure at a healthy level, okay? Now, let's talk about minimizing some side effects of BP meds. So if you want your side effects to go away, I mean, if something is causing you to be dizzy, you should take that thing off, right? So if you want to stop dealing with your side effects, then you can just stop taking your medications. But I wouldn't recommend that. I would say first reduce your dosage if your side effects are, very intense, okay? You can reduce your dosage, speak to your doctor about it, okay? And the next thing is you can boost your immune system, okay? If your side effects are so intense, it means that your immune system itself is not even strong enough to support you, okay? And how do you boost your immune system? Boosting of immune system, it's a daily effort, okay? You have to get in all of it. As a human being, with the way God created us, every single day, there is a nutritional target that you must meet. And if you slack in that, months go by, years go by, you will develop things like hypertension, like high cholesterol, okay? So boosting your immune system, you do that by getting your daily nutrients and your daily antioxidants, okay? And you can also reduce your sodium and increase your potassium and magnesium. Now, this third point here, reducing of sodium plus an increase in potassium and magnesium, has the same effect as your BP meds themselves, okay? So imagine if you reduce your salt intake, but you don't just stop there, you also increase your potassium and your magnesium. That is, you take in foods that are high in potassium and magnesium. You would experience, like, does this mechanism, should I say, alone, is the same thing as your BP medications. Like, that is exactly what they do for you, okay? So this is something that I think everybody should take seriously. Instead of just reducing your sodium, increase your potassium and your magnesium. Okay. And if you are on wellness already, then you don't have to worry about that because you already have your daily intake of your potassium and your magnesium in that multivitamin tablets. Okay. And the next thing for you to minimize your side effects is to exercise frequently. Okay. I know this is sort of, I don't know, it sort of counters it because hypertensive medications reduce how much you exercise. But if you can exercise frequently, then it reduces some of your side effects. Okay. Please excuse me. All right. So what are some lifestyle modifications? Now, if you've been with me since October, there was a live video that I did when I spoke about lifestyle modifications even being more efficient or effective than your medications. Okay, it's true. So your nutrition, your choice of beverages, your physical activity, how much rest you take in. I know this country alone is enough to give somebody hypertension, but you need to sleep. You need to rest. Okay, your environment. Are you in a stressful sort of environment? I don't know. When my dad was dealing with hypertension, we are many kids in the house. We're like 5 children in the house, and we run up and down a lot. Okay, especially the younger ones. So my dad would tend to like shout a lot. Okay, and my mom would call us together and say, "Stop making your daddy shout." Okay, your environment matters. Okay, also your stress level, your social support. Do you have people around you that are telling you that you'll never be done with hypertension? Okay, these things, they do matter. Okay, the things that you hear, the things that you listen to, do you actually believe that you as a hypertensive patient, that you are doing enough for yourself and that you can do better? And that whatever it is that you are doing for yourself would get to your desired results? Do you believe that you can be done with hypertension? Okay, so use of natural means, for those of you who are on wellness supplements, those of you that, take good care of yourself, you know that you follow this list. Okay, you are refraining from pressures and excesses, you exercise faith in God, you meditate. So you don't have to follow this list, like every single one of them. There are 10 in number. So if you can focus on just 5 or 7, you would get the same results. Okay. You changing your lifestyle, the way you eat, the way you rest, the way you exercise, how much you exercise, your social support. These things, they can seem ineffective, but they are even more effective than you taking a pill. Because as you take, I'm sorry to tell you, but as you take these medications, the quality of your life decreases. Okay, so as much as you can, and I feel deeply for those of you whose blood pressure has never risen above 140 and are on medications. You're not supposed to be on medications. Okay, so if you can, do as much as you can in making sure that you follow lifestyle modifications more. Okay, so that you can reach the stage of not having to take a pill daily, or at least reducing your dosage. Because I know some of you are on 3 meds, 4 meds, some people are even on 6. Okay, so please, if you can, focus more on your lifestyle choices other than depending solely on your medications. Okay, so that is it for today. We've basically come to the end of this session. 7:40. Yeah, I said this was not going to be more than 40 minutes. So I'm right on time. Okay, so do we have any questions for me? Comments, questions? I know some of us, because the times I held the webinars are different. Yeah. So you can just go through my Facebook page. Okay. There are some videos that I've done. I know I have one on headaches. Mr. Paul asked me to do one on headaches. I think I should have that on my page already. There was a time I spoke about antioxidants. I even spoke about stroke. Okay, so you can go through my Facebook profile, okay, my Facebook page, sorry, not profile, and you can see some more, valuable information that can help you. Okay. So thank you. Thank you for being here with me. Any questions, please? Comments, questions? Please use the chats. Don't worry, Mr. Cletus. This session is recorded. So I would put up the replay once we are done. You're welcome, Mr. Paul. You're the first joining. Thank you. You're welcome. If there are no questions, I would like to know what you thought about this session. So any comments? If you have something to tell me. Mrs. Gladys, how do you deal with the issue of fake medications? Why would a pharmacist even administer fake medications? I would say go through your physician and their recommended pharmacist instead of trying to buy over the counter. Okay. I don't even know why we deal with such issues. Why would we have, why would we be dealing with fake medications? If you have a recommended pharmacist that you use and you trust, okay, that could help. Or you can ask your physician to recommend or like to, sort of direct you so that you don't buy the fake ones. Also, I would check, maybe research on how you can know the difference, that's on my part anyway. So that I can maybe explain. I think it's a good thing to talk about, a good content. Because these days I don't even know what to talk about with you people, honestly. I'm like, what should I talk about today? Mr. Paul, my account details. I don't know if I should put it here on Zoom, but you have my number already. Yeah, so you can just contact me if you would like to get the wellness pack. I joined late. I would send questions to your WhatsApp. Okay. Mr. Babajide, it's so nice to have you here. It's so nice to have you here. Okay, any more questions, please? Comments, questions? So Mrs. Gladys, I would prepare a short slide, okay, on how we can know the difference between fake and real medications, if there's something like that, if I can find one anyway. But for now, I would say you can go through your physician or a trusted pharmacist to help you. Okay, anything else? I almost finished with the first part, though a bit of improvement. A bit of improvement is good. We thank God for that bit of improvement. Okay, anything else? Do we call it a day? Do we call it a night? Okay. So thank you all so much for joining me. I appreciate you taking out the time to come listen to me, talk to you. It's a privilege that I don't take for granted. Okay. So thank you for being a part of my audience. I appreciate you all. And please forgive me for not checking up on all of you. I know I'm supposed to be making some calls here and there. Please forgive my schedule as a student, okay? That's why sometimes I like doing live sessions, because it helps me sort of speak to you. Okay, at least a bit relaxed my body system coupled with little exercise. Yes, I remember Mr. Augustine actually spoke about that. You know, as you are on your wellness supplements, you should make sure that you don't take in a lot of salt and Maggi. He sent like, I think it was a 10-minute audio in 3 parts. And I think I have sent those to the groups, right? So, and also physical activity as well. Okay. So yes, wellness can help you, but getting rid of hypertension is more of a you work than a product work. Okay. So you also have to play a part by making sure that you exercise. But I'm glad that at least you do have that relaxation. Okay. It's good. You're welcome, ma'am. Some time ago, my BP was spiraling even with the meds, and the doctor said I should buy directly from a salesman to avoid fakes. Well, that's good that at least the doctor told you where to go, you know. So does it mean that you were on fake medications while it was, you know, going haywire? I will do my part in trying to see how I can help you avoid fake medications, okay? So thank you, Ms. Gladys, for bringing this up. It's something that it's nice to talk about. It's a good content idea. Okay, usually it takes 30 minutes for the replay to be uploaded to YouTube. Okay, so 8:30, 8:20, you should have it, Mr. Cletus. Yes, I'll send you the video, okay? Thank you. Even though I feel like I don't contact you enough, I do not contact you all enough, but thank you so much. Thank you. I almost canceled this session today, honestly, because I was very, very tired. But I said, no, I've already canceled the first one. I can't cancel again. So thank you for being here. Yeah, thank you. Anything else? Or we call it a night. You're welcome. Don't forget to vote on Saturday. May God help us in Nigeria. Okay. All right. Anything else? Seems someone is writing on my screen. So I hope that you actually found where your medications are in this list that I gave. I hope that at least you saw some of your medications there on the list. So at least you know what is doing to your body. All right. So thank you all so much for joining me today. I appreciate you taking out the time, 15 minutes of your time. Okay. So we'll speak again shortly. All right. My birthday is in 12 days, and I don't know what to do for all of you. Do I give you discounts when you shop wellness? You already have free delivery. So what else? What else do I do for all of you? Maybe if anyone can guess my age correctly, I'll give that person a discount. Yeah. But we'll talk about that later. All right. So bye. Good night, everyone. Take care. Take good care of yourself. Okay. Yes, I would make the recording available. Okay. All right. So I would stop sharing now. Bye.